After explaining the benefits and risk of procedure to the guardian, obtain written consent, review the lab parameters, and check your equipment. After procedural sedation with midazolam, position the patient supine. Proper identification of the biopsy site is of paramount importance. To choose the biopsy site, identify the upper border of the liver by percussion. Biopsy site is located 2 to 3 intercostal space below this upper border. Usually it is between 6th and 9th intercostal space in mid-axillary line. Mark the biopsy site with the surgical pen. Mark the biopsy site with the surgical pen. Clean and wrap the biopsy site with iodine. Infiltrate the skin over the site with 2% lidocaine. Administer it further in both superficial and deeper planes. Then with surgical blade, make a small nick at biopsy site. Nick should cut subcutaneous and deeper layers also. This is the Mangini biopsy needle. It has got two parts, the insertion needle and the suction chamber. The insertion needle is marked by grades. The distance between two marks is 1 centimeter. This is guard. And this is suction chamber, and this is suction chamber. It has got lock. The guard on the needle is set to the required depth according to the age of the patient. Elbow and the forearm should be in line so that the needle should be parallel to the bed and in line to the site of biopsy. After penetrating through the skin, superficial tissues and subcutaneous tissue, you will feel a give-way sensation. At that time, create suction by pulling the plunger back and advance the needle into the liver up to the mark by guard, then quickly remove it. Whole in and out movement should be smooth and should not take more than 1 second.
Release the lock and save the sample in formalin and label it and send to the histopathology. Apply the pressure bandage at the site of biopsy and position the patient in light lateral for at least 3 hours. The patient can be shifted to the recovery for monitoring.